Hello, good day, everyone. My name is Dr. Kong Wei Yan, a consultant physician and nephrologist. I'm tasked to give a lecture about a war on obesity today. So what is obesity? Obesity is defined as abnormal or excessive fat accumulation that may impair health. Just want to show you some statistics here, some scary, very scary statistics indeed. Worldwide obesity has nearly tripled since 40 years, 50 years ago. In 2016, more than 1 billion adults 18 years and older were overweight. Of these, over 650 million were obese. Over 340 million children and adolescents aged 5 to 19 were overweight or obese in 2016. Most of the world's population live in countries where overweight and obesity kills more people than underweight. And most importantly, obesity is preventable. This is basically the worldwide statistic. How about closer to home in Malaysia? If you look at this cartoon, this diagram here is extremely alarming actually. If you look from left to right, each human figure represents one country. And look at Malaysia. Malaysia is technically the fattest, the most obese country in Southeast Asia, comparing to countries like Cambodia, Laos, Vietnam, or even comparing to Thailand and Singapore and Indonesia. We are doing far worse than these countries. And this is basically the percentage of people who are overweight. In other words, 44.2% of population in Malaysia is overweight, and that translates to 2 out of 5 essentially. And this is just to summarize what I mentioned before. Obesity, as you can read from here, 2 daripada setiap 5 orang dewasa mempunyai berat badan berlebihan ataupun obese. This is right here in Malaysia. 2 out of 5, extremely alarming. How to calculate is there a marker for obesity? The simple answer is yes. And one of the marker that we use is called body mass index or BMI. It is a very simple and very useful measurement, and you can calculate it just with your simple calculator if you know your weight and know your height in meter. So for example, if a lady by the name of Sarah, her weight is 50 kilogram and her height is 1.55 meter. So what's her BMI then? So you can use 50 divided by 1.55 divided again by 1.55 and you get an answer of 20.8 kilogram per meter square of BMI. So her BMI is considered normal. And I'll summarize to you what are considered normal: overweight, underweight, or obese, or morbidly obese, and things like that. So take a look at this table, and these are the classification that I just mentioned. When we have a normal BMI, it's averaging between 18.5 to 25. When a person is underweight, their BMI is less than 18.5. Overweight is defined as BMI of more than 25. Pre-obese is 25 to 30. And then you have got multiple classification of obesity as well. Whether a person is morbidly obese, moderately obese, severely obese, or very severely obese. And this is the newer classification. And then last time we just classified them as overweight, obesity, or morbidly obesity. But now they have got a more complicated classification. What causes obesity? Of course, one of the major issues is food. Highly processed food, food that are very high in fat and sugars. How about activity? Activity and stress can also cause obesity. An increase in physical inactivity due to increasingly sedentary nature of many forms of work. I think many of you are just like myself, drive to work and then drive back from work. And then we just makan and we seldom bersenam and things like that. So all these sedentary lifestyle are going to cause us to become more and more overweight and obese. And of course, a lot of us here are not taking public transportation to work. If a person who is taking public transportation to work, maybe their chance of shedding some weight is higher as compared to people who are like us driving to work all day long. And then it's very important to keep track of our calories as well. If we consume more calories than that we use, of course, the calories will be stored in our body and then translate to fat. Also, another risk is, of course, increasing urbanization, which is unfortunately a trend nowadays. Raised BMI is a major risk factor for non-communicable diseases. These are the health consequences of obesity. When a person is obese, the obesity can basically stress a lot of organs, including our joints, causing osteoarthritis, especially of the knee joints. It can predispose us of getting diabetes mellitus. So that's why a lot of you might have heard stories, successful stories like people with diabetes and when they are very overweight, when they cut off their weight by doing diet and exercise and controlling calories, when they are no longer obese or overweight, their diabetes disappeared. So this can happen. People who are very, very obese can have increased risk of cardiovascular diseases, for example, heart disease and stroke. And then the scary thing is many cancers can be associated with obesity as well. For example, endometrial cancer, breast cancer, ovarian cancer, prostate cancer, liver, gallbladder, kidney, and colon cancer. All of these might be related, or the chance or the risk can increase in this setting of obesity. And also, childhood obesity is associated with a higher chance of obesity, premature death, and disability in adulthood. Um, so don't you try to think that we can let our kids to be fat, and then next time they can reduce their weight later when they are getting older. Better not. Better don't think that way. How to overcome obesity? Of course, there are multiple ways that we can manage obesity. And as doctors, we frequently use drugs, and just our surgical colleague can use surgery to treat morbid obesity. But first and foremost, we need to focus on our lifestyle modification. So fight obesity, we focus on three main ways. Of course, I'm not going to talk about the medication that we can use to reduce weight. I'm not going to talk about surgery. I'm going to merely focus on three things today, which are diet, physical activity, and also behavioral changes. So let's say if we don't have this modification in our lifestyle, if you are able to cut down your weight successfully with surgery or medication, without all this modification, you are going to go back to being obese as well after a few years. The energy balance concept. I think I mentioned this before. Ensure the food that we consume are balanced by the activity we have done. This is very important to maintain healthy weight. So nowadays, most of us are using smartphone, and then you can easily download some app that can help you to calculate the calories consumption. And we can try to limit fatty meals, processed and highly processed food, for example, fast food and also high sugar food. Instead, we try to choose for healthier choices such as whole grains, nuts, lean meat, and a healthier version of seafood like fish. Um, and then we can choose to increase intake of fruits and vegetable as well. Fruits and vegetable, of course, as you know, are low in calories and also they are high in fiber. So they'll make you feel full after you eat them without causing so much increase in your calories. So they are very good for weight and health maintenance, beside having a host of other benefits. You can try to choose healthier cooking methods. So instead of deep fry, other methods can also be used, such as steaming, boiling, and grilling. And then you can try to control portion. Of course, for those of you who remember, last time when we were in school, we were taught this phrase called suku suku separuh. which means that we should separate our plate into a few portions. And then protein and also carbohydrate should be just suku, 1/4 of the portion of a plate. And then separuh, which is half of the portion of the plate, should be consisting of fruits and vegetables. So more fiber, more fruits by eating more fruits and vegetable, and control your carbohydrate. And then protein also 1/4, uh, similar to the portion of carbohydrates. These are some examples of suku-suku separuh with Malaysian food. You can take a close look at this. Second thing I want to mention beside diet is physical activity. And I'm showing you here a physical activity pyramid. You can try to go through this in detail. But a lot of people think that they don't have time for physical activity. And in fact, when we are talking about physical activity, you really, really don't need to run a marathon every day, for example. And just basically cater the physical activity towards your need, towards your time schedule, and towards your fitness, and always work your way up. It's never too late to get started. Of course, if you haven't been exercising for a long time, you don't need to start by running for 1 hour, for example. You can start slowly and try to accumulate your physical activity and build your way up. For example, if you haven't been exercising for a while, you can try brisk walking, walking very fast for 10 minutes. And then after a few days, when you are more fit, then you can do brisk walking for 15 minutes and gradually build your way up. And when you are getting fitter and fitter, then you can start, slow walking, slow running, and then convert to running exercises. And then gradually work your way up to 15 minutes, 20 minutes, and half an hour, for example. And this diagram, this pyramid here will illustrate more if you look at it carefully. There are a lot of exercises that you can do actually. And benefits for physical activity, these are just a few of the benefits. Of course, it brings a lot of other benefits as well. Some of the example of physical activity benefits would be improving your memory and brain function, protect against many chronic diseases, help to manage your weight, lower your blood pressure and improve your heart health, improve your quality of sleep, reduce feeling of anxiety and depression because after you exercise, it produces a lot of good hormones, for example, endorphin, improve joint and pain and stiffness. Because when you are doing exercise, you basically build up the muscles surrounding your joints and your ligaments and bones. And then it maintain muscle strength and balance, increase lifespan, improve body composition, appetite control. It can help you to control appetite. It can help you to improve cardiovascular and metabolic health, and it can help you to increase metabolism rate. The last one is very important because a lot of us think that we exercise to shed calories directly. But another way exercise can help you to control your weight would be if you are quite fit, if you exercise regularly, then your metabolism rate will be higher. When your metabolism rate is higher, then it's very easy or easier for you to shed your weight with the same amount of food that you are eating. When your metabolism rate is very low, then whenever whatever you eat, however little you eat, also you might gain weight because of the imbalance in the calories intake and output. How about behavioral change? This might be, even more important than diet and physical activity. So basically, behavioral change, you really, really need to, make a conscious mind to try your very best to change your lifestyle, basically. Basically, try to change all the bad habits. And a lot of us, when we are eating, we bring up, our handphone, and then we eat when we are typing messages, and we just chunk down the food, don't even have time to enjoy the food. And then some of us, just because we want to save time, we basically spend about 5 minutes, to finish our meals. And some of us do have the tendency of skipping meals. And when we become very hungry, then we eat a huge meal. So all these are very unhealthy habits that we have to consciously try to change for the better. And then these are just, some of the things that I mentioned before. Um, In conclusion, obesity is an abnormal or excessive fat accumulation that may impair health. And obesity can impair health and lead to many diseases, as I mentioned just now. There are many ways to fight obesity. Three of the more important ways would be through diet, physical activity, and also behavioral change. If we are not able to control our weight with these measures, then you might need to think about seeing a doctor to discuss about using other means of losing weight. With that, I thank you for your attention.